Today on episode 7 of Healthcare Uncut, I have Ashish and Akash, who are the founders of Dime Health, an AI health tech startup based out of New York City, actually, which is a phenomenal story of two childhood friends that went two separate paths and ended up reconnecting around the health tech startup space. We talk about the inception, the formation, their strategy, what they're looking to do, and how they're already revitalizing the space and so many aspects of the healthcare delivery system, starting out in radiology, moving that into referrals, and ideally going to take over the payer landscape. We talk a little bit about their brand, what they can do to help build that brand, and how they see themselves positioned in the market. It's a great listen. I would encourage you to follow these guys on their path to growth. And thanks again for tuning in. Tell me a little bit about you guys, man. Introduce yourselves. Tell me a little bit about your history.
For sure.
How you guys got together and where we're at.
Yeah. I've known Akash for what, like 13, 14 years. We both grew up
high school, college, at all.
Yeah, we both grew up like right around the same area in Michigan, Metro Detroit area. It's a small little area, and everybody kind of knows each other from high school onwards. We both went to Michigan for school, so stayed right at home. We took different paths in life, so I started my career out in finance, started investment banking, then moved into becoming an investor. Akash probably took the smarter path in life. Started out as a computer engineer. Then we kind of deviated a little bit. He went and did his master's in AI at Georgia Tech, and then went into Snapchat, where what you were doing content moderation, which I guess you'd now call like old school AI, right?
Yeah,
not
it's
traditional
crazy. In the last 3 years, all those models are obsolete. It's like a brand new thing now.
Yeah. And literally, I remember in early 2023, we've kind of been now 4 or 5 years into our careers. Akash has been in the space for a while, so he texts me and goes hey, there's this new thing that you should check out, like ChatGPT. I think it was actually late 2022. We were probably one of the first couple thousand people on it, and I had no technical background. So I'm just playing around with this thing, and I ended up developing an app. It taught me how to download VS Code, write Python code. And immediately I think we both saw that something's about to change here. This is probably the dot-com bubble of our generation, the dot-com boom of our generation. So we started tinkering on the weekends, seeing what is this technology actually good at. It was so early. Nobody really knew what you could do with it. Went through a couple experimentation cycles, then landed on a couple of things that we were pretty excited about. It became kind of obvious to us at the end of 2023, document synthesis, document outputs and structured generation of data is it's pretty good at that.
Right.
And we're okay, how can we apply this into different areas? So after a couple experimentation cycles, we narrowed in on healthcare, primarily motivated by the fact my parents are physicians. So we kind of had a little insight into how some of these practices work, went into these practices.
Do you mind if I ask what type of...
Yeah, my dad's a radiologist, my mom's a neonatologist.
Okay.
So in radiology especially, a lot of what happens is admin work, right? It's the field that gets the most referrals in the country. You break something, you said your uncle's an orthopedic surgeon, first thing he's going to do is try to go get an MRI, an x-ray, something that actually gives him a view of what's going on inside.
Right.
So we're going inside these healthcare facilities, seeing what does the business look like? How do these facilities operate? And then we realized very quickly that behind the scenes, if we just take out the clinical work, a lot of what happens is just moving data from one system to another. We called it the human API, right? You've got these humans that are taking data from paper, putting it into one system, taking data from that system, putting it into a portal, taking data from that portal, sending out an email to this person. And we're okay, we can automate this. Right. And we didn't want to boil the ocean at the start, so we focused on one very, very specific aspect. One of the facilities we're working with, they're just getting a ton of faxes. And it's kind of crazy to us, but there's this specific law in HIPAA which allows fax lines to be HIPAA compliant. So a lot of healthcare facilities still operate with faxes.
Right.
And we're they're getting a bunch of orders. We see this practice manager is spending literally her whole day. They're getting 200 orders a day. She's spending her whole day just taking personal information, putting it into their RIS system, radiology information system, figuring out what the specific procedure is, putting it into there. And we decided, we don't know if this is actually a need, so why don't we just try selling it to people? We cold emailed a bunch of people. Somebody gave us a shot. We developed this
specifically radiologists too.
Specifically radiologists, yeah.
Super niche.
Super niche, because we knew they did a lot of referrals.
Yeah.
That's where we started, and if they're doing a lot of referrals, that means they're probably getting a bunch of faxes. And somebody gave us a shot. They were like, why don't you come over and show us what you got? We built this demo, which literally just took a couple of pieces of data, like name, date of birth, the specific procedure type out of a form, and all it did is just showed you that on a screen. And these ladies are very, very nice. They like saw this. They're like, okay, cool. Like you might be able to do something here. And we kind of faked our way through it. Sure. We sold them, and we're like, we will from now on handle like all the ways you guys are taking orders in from these faxes and putting it into your wrist. And for the first month, there was no like AI. It was Ashish and Akash acting as human APIs.
Yeah.
We're taking out data and putting it ourselves into the wrist, and it was like a painstaking job. Like you can't imagine our whole days were just going into this. And slowly, we started to learn, okay, like what does it take? Like what are the actual decision patterns we're making to go ahead and do this? Because it sounds pretty easy. Like you're taking data out of a form and you're putting it into a system, but like there's a lot of different nuances that come into that. And then slowly we started taking the decisions that we're making as humans and basically giving that context to LLMs and automating it. And over time, that just evolved, man. Like we got really good at the different type of medical forms that are out there. Because medical forms come in all different flavors and sizes. You get really crappy handwriting, dealing with the nuances of that. And then we adopted the principle of like automating things that happen 10 minutes before and 10 minutes after when we do the work. So what do they do 10 minutes before they get the order? And what do they do 10 minutes after we get the order? So today what Dime Health does is we automate pre-visit workflows. So we basically help clinics. Our goal is like from the moment that you get a referral, we're going to have a patient booked for you in 20 minutes, and we're going to do all the work that comes with it. So we're going to put the order into your system. We're going to go ahead and get that patient scheduled, and we're going to prepare the prior authorization form that's required for you to be able to get approved.
That's amazing. For somebody, Ashish, who says they're not technical, you got pretty technical pretty quick, right?
Ashish is quite technical. He's selling himself short. Just with all these AI tools, I think anybody today can do anything. Being a software engineer, I felt like a lot of the things I learned at my job or school are, just kind of siloed. And like traditionally what you do is like, okay, you go out and work in like this sector of AI, very much like you're saying, like a niche in healthcare. It's like you work in, I don't know, like content moderation, right? And that becomes your career. Everything you do is around this one problem that you're solving using the same set of models, usually around the same data sets, and people do like 10, 20, 30-year careers, and that's it. But now, today, it's like anybody can do anything. Careers are not so straightforward. You could kind of we were working with risk systems. At some point, we were working with like robots, we were working with machines. Like there's just so much we could do in such little time that I just think it's kind of for everybody.
It's a pretty cool story to hear. A couple of childhood friends basically decide that they're going to use a new tool that's effectively free. Right? I mean, the cost of entry to use ChatGPT is in comparison to starting an app 5 years ago. You'd have to have maybe one or two full-time software engineers and $500,000 to get an app off the ground. Now you can pay the $20 a month, subscription fee, and have an idea and some work ethic and create something. It's really cool to hear that. So now, started out in radiology, niched down a little bit, realized that you really wanted to focus on kind of the pre and post workflow of a referral. Where does that leave you guys as a company? Have you seed round? Have you done a Series A? Are you going to kind of go IPO route? What's the goal for Dime Health outside of helping to solve some of the communication aspects?
The goal is to basically take over healthcare's revenue cycle management. And to do that, we just want to make sure our customers are happy with us at all times. As far as funding goes, we've been fortunate enough to have people give us a shot. One of the people that we used to look up to, Dalton Caldwell at Y Combinator, was our first investor. We've since raised another round of institutional capital, but really like the valuations, all that stuff that you see is kind of noise. Like what matters is when I get a call from a customer, are they happy?
Sure.
Are they getting their problem solved? Are they saving time? And that's really what it is. And I think like even if we look back 2 years ago to where the technology is at today, even in the last like 6 months, the ability for our agents to have agency over some of the tasks they do give me a lot of belief that, well, we don't have to stick to very rigid workflows. We just have to give AI a generalized skill set that it can then do a lot of things over. Sure. And I'll explain what that means. Like, let's say we teach it how to like navigate an IVR tree. Now I can teach it how to like call insurance companies and wait on hold on behalf of people, right? And you'll notice that like the entire revenue cycle is actually just that. Like, we've got all these consultants at Deloitte that are like trying to optimize every little piece of it, and majority of these RCM companies are basically just outsourced companies that exist in India or the Philippines, and that gives us a lot of opportunity to take this generalized skill set that we're building into our technology and apply that into these bits and pieces until we're going to take the whole thing over.
It's also more cost effective and more accurate.
Yep.
Because you can quantitatively measure, how many of these cases is it actually solving, like what are your success rates, and more than that, you could use evals to then tune the models to be even better.
Right.
And you're reaching a point where it's better than humans at reading handwriting, or like being able to pick the right insurance code out of a sea of like 2,000.
Right. How do you guys? So the opportunity for what you're doing is pretty much endless.
Yep.
Right. Looking at the payer situation is obviously, if you want to take over the complete revenue cycle side of things, it's wide open. There's also a lot of entrants, right? I mean, I think in San Francisco alone, there's probably 400 AI companies. And most, when I say AI companies, not foundation models, right? I mean, you still have the 3 or 4 foundation models that exist, but everybody's kind of doing the same thing, right? Hey, how can we take something layered on top of what's existing and then expand it, create our agent, create our model, create our whatever. One of the questions is, so as you start to see use cases, right? You work with one company or whether it's an office, a system, a hospital, a payer, what have you, you could start with, maybe it's just a revenue cycle management, but then you're like, hey, we have not just a referral, but we have an eligibility issue, we have an inbound appointing issue. How do you guys kind of stratify the need based on what, not could the system do, what could Dime Health do, but do you have the capacity to take all comers, or are you really going to focus on a lane and then kind of expand later on?
Yeah, that's a great question. I think the way we're kind of imagining the product as it is today is a bunch of skills put together, right? Like, we have voice agents, we have document agents, we have insurance agents, and we just know the capabilities of all these little tools and what they can do. So to answer your question, the problems come in different flavors. And if we have like the underlying tools and we have a way to spin them up very, very quickly, we're able to kind of apply that in like a forward deployed fashion. And that's ultimately where things are today as well, because even within radiology, it's not always the exact same workflow, right? Like, you might have one facility that thinks about insurance a certain way. Like, they might be like, okay, our billing team needs the exact payer code to be able to bill correctly, whereas somebody else might be like, okay, like, this isn't as big of a priority for us, but you need to put in the procedures and like the dates and the schedule times almost perfectly. So the requirements are a little bit different across the place, and so we're kind of just focusing on building the underlying tools and being able to scale them to solve these like different problems.
I guess, like, translate this into a human for a second. Like, how do you train a human, and then how do you apply them across all these different things? So you get a human really good at like going to different portals, and they know, like, let's say it's eligibility, right? They know like how to do the math to then figure out how much deductible does this person have to pay. They know like whether, then they can apply that to whether it's Blue Cross, whether it's United Healthcare, whether it's like Aetna. They know like they go to these couple of portals, they touch these couple of screens, and they kind of have the context to figure it out. So if we apply generalized skill sets to our technology, then it can do all of that, right? And if we train it on talking to the phone with a patient, it's pretty similar on it talking to the phone with a person that's working for a payer, right? So it's about building generalized skill sets. And to your point of like, how do you think about like 400 companies competing in the space? Like, frankly, if there were not 400 companies competing in the space, we're probably in the wrong space. The fact that there is this much opportunity, the fact that there is this much opportunity is why there is so much competition. But like I always tell people, like, do you know how many EHRs there are for every specific specialty that are all worth like a couple $1 billion, and they're all still so crappy? They all still have such poor service. And if we can just do that and do that better, well, that's our like local minimum, so to say.
So it's a really good point. I mean, competition, generally speaking, is what creates innovation and better quality, ideally. And I think you're right. I mean, there's obviously many companies in every industry. At some point, consolidation starts to happen, right?
For sure.
You think of big tech companies, and there's a lot of technology companies. There's only a handful that are multi-trillion-dollar companies. And at some point, hopefully, you guys are one of them that gets there. How do you think of? Well, one, I had a quick question on hallucinations, right?
Okay.
So as a basic end user of any of the platforms, there's times when I'll ask it something, I know the answer, a part of it, and I'm like, that's not right.
Yeah.
Is that a factor in how you guys use it?
Yeah, it is, and I think there's flavors to it, right? Like what we call like one-shotting a prompt. Is more likely to lead to hallucinations. But the way we kind of think about it is each of these different workflows regarding a document, whether we're dealing with the patient demographics or we're dealing with referring provider, or we're dealing with insurance, we're dealing with different parts of the document. We have a lot of eval and verification agents on top whose entire job is really just to reduce those hallucinations. And the state of the models today, they're a lot better than they were a year ago, right? Like Opus 4.6, for example, makes very few mistakes. So will it get there to a point where you could just one-shot an entire document and gives you exactly what you want with no hallucinations? Definitely.
Yeah.
But for today, we're just making sure that those eval agents are doing their job.
Sure. Yeah. So you just kind of put a risk layer on top.
Well, play the probabilities, right? If you've got a 25% probability that like you're gonna hallucinate, now if I'm like taking out a procedure code and matching it to another procedure code, and I have 3 models do that, and I make the 3 models vote which one is right. If I'm just playing the probabilities, the chance that each one hallucinates is 25%, but the chance that all 3 hallucinate and they disagree with each other, that's like the probability is low. So that's one way to get around it.
Yeah.
Like.
And even compare it to human error.
Exactly.
Right. So like we're talking about it in the AI context. You asked earlier, how do you train a team of people to understand soup to nuts, start to finish? Human error is a massive part of mistakes in health in any system, but healthcare too, right? I mean, many folks in hospital systems die because there's a human error, medication administration, wrong dose, like it happens, right? But I would imagine that with technology, we're decreasing the error, even if there's a base layer of hallucination or something, right?
And I'll give you a couple examples. Like then let's just focus on document management for a quick second. We get a packet of like 8 pages, let's say, and on the first page, like it says, I want an MRI of the brain. But somewhere on like page 8, it'll say we want this specific protocol of an MRI because we believe that this person has had a traumatic brain injury. Now, a human might not go all 8 pages deep. And they might miss the fact that like they want this specific protocol, which is only served by this like 3 Tesla machine. An AI, with the context windows we have today, it'll read all of that. It'll get the right protocol out, and then as long as we've got the faith that like all of our models aren't getting it wrong, we're probably going to exceed human performance. And like if you talk to our customers, they'll tell you that all day long.
Yeah.
We actually have a very specific example that happened recently where our scheduling algorithm can schedule procedures across resources. So like let's say someone comes in and they want to have like 3 MRIs done, right? And you have 3 machines on the floor. And typically what our schedulers would do is like have them on the same machine back to back. So you need to find a slot of like an hour and a half to be able to schedule this one block for the patient. However, our algorithm was able to kind of look through all the different resources. So it was like, well, how can I get this patient in, like, let's say MRI on machine 1 and then go over to 2 and go over to 3. And, like operationally, it's a little awkward, but at the same time, you're able to get in 3 times as many patients because you're able to fill up those slots very effectively that humans just can't really compute in their head well enough.
Yeah. No, that's a really good point. I think that we use a competitor of yours to do. We haven't onboarded them for scheduling yet. They do scheduling for others. We actually brought them on for kind of outbound calls first. Before I work in the managed care space, so I want to talk a little bit more about revenue cycle. But in managed care, there's a lot of quality requirements that we are obligated to under CMS and then the health plans. A lot of it's just getting in touch with the patient to have them come in for a certain type of visit or a test or what have you, right? Prevention, breast cancer, colorectal screening, blood pressure tests, all that kind of stuff. And humans just have a natural aversion to getting on the phone.
Yeah.
There's resistance. Is the person going to pick up and be upset?
Yell at me.
Exactly, right? And so there's just a lag time in between calls. So we brought on another company, and it's like 10x their ability. And a lot of times, the information that gets brought to us from the health plan is bad. It's just a wrong number. You know, it's a handwritten application that gets scanned in. Some system picked it up wrong. It's a wrong number.
Yep.
But a human would have, I don't want to call. They hang up. Like, that's just a waste of time.
Yeah.
Right.
You can put an agent on it and it's done in like 10 seconds to realize like, hey, you need to go back and work on it. On the revenue cycle side, how do you guys see this infiltrating? Because you have government payers, so you have both the Medicaid and Medicare system that is kind of currently a fee-for-service model.
For sure.
You have ACOs that's both a shared risk and a full risk. So you take the professional side and the hospital institutional cost side, and there's transactions there.
Yeah.
You have managed care, you have private insurance. There's a lot of transactions.
100%.
How do you guys see what you're doing starting to infiltrate into that? It's a very big C.
For sure. And the reality is there's a lot of different processes. They all kind of have some sort of similar thread. Ultimately, like just if we dumb it down, we're doing a procedure, we want to get paid for that procedure. You have a bunch of different requirements that you need to pay me for that procedure. One company might require me to submit a specific form on a portal right after I'm done. One company might require me to fax them a form. They all use like generic codes that are available on the Medicare site. We'll take the CPT out, we'll take the specific diagnoses out. All they want to see is like, prove to me that this is medically necessary. Here is the specific procedure I want you to follow to prove to me that this is medically necessary, and here's how you can track that I will pay you. Now again, it goes back to 2 years ago, I would have told you like now like across these 2,000 plans, I got to come up with like exactly the workflow that each plan follows and train 2,000 separate LLMs how to follow each one of these processes. Look at what you can do today. We can train it how to understand the context behind what it's doing. So literally like you are a professional medical coder, code this specific exam into this CPT code this specific diagnosis into these ICD-10 codes, and then a separate agent just follows, figures out, okay, how does this portal take this specific information and feeds it in there? So again, like I'd argue, yes, there's a lot of different people and a lot of different participants, but ultimately, like, dumb it down, and they're all kind of doing the same thing. And like a human, like if I asked you today, apply yourself into managed care or go get me paid by one of these Medicare Advantage plans, with the context that you built up over time, you'd be able to do it because it's generalizable enough.
Yeah, another thing is there's a very strong tailwind on our side. These models are just keep getting bigger and bigger context windows. And what that enables us to do is like before this, like we might need to go scrape every single bulletin there is, like develop rule sets and then pass that context into our model to be like, okay, you know, code this way or pick these ICD codes for this particular pair. But now it's like, it just keeps getting bigger. So you're just able to spread it across the web. So in theory, every single plan could be solved for with a single agent.
Yeah, it's pretty cool. So I mean, the answers really are technology can scale much greater and faster than humans can. So if we can have hundreds of people that have to deal with these transactions, there's no reason why an agent, however you define an agent, right? Some energy source that can compute these things, right? And complete it faster than a human, probably with greater accuracy.
Exactly.
Yeah, and the other thing is like, a lot of it's just fragmented systems. Like you're just talking about different portals. One of the biggest waves we've seen is just using these agents to control computers, like just the evolution of RPA, and that's just been like a boon to us. It's allowed us to circumvent certain integrations. It's allowed us to navigate different systems very effectively just by giving these agents the ability to use a computer.
I think that's where our product stands out as well, because our integrations are extremely robust. Like typically, you know, the FHIR APIs or HL7 integrations, like you're paying per protocol and you're having to do all these complex bi-directional syncs. And like, let's say you're not able to pull a report anymore, right? Like you need an ORU message, then you need to go get that interface built. It's going to take you 5 more weeks. But with what Ashish said, the integrations being done with the computer use agents, we're able to get customers up and running in like 2-3 days, and we're able to do anything they want to be able to do.
That's pretty awesome. And do you have like a dashboard that they log in, they start tweaking things? Is that kind of the functionality? You onboard them, you deploy some type of a dashboard, and now if they're like, hey, we have a new use case that we didn't talk to you about, can they just establish it inside of the dashboard, or do they need to kind of put in a request? How does that stuff work?
Today they kind of have to tell us like what the specific workflow they want is. In the future, like to hit all these use cases we want, it has to be generalizable enough where a human can do it. Today, like a lot of it's just, man, like there still needs to be a little bit of technical know-how on how to distill the information out of your brain. Right? Like that's what it is. Humans struggle at just getting the context out of their brain and feeding it into an LLM. Like the specific use cases are like, okay, well, I know how to schedule this specific patient for this specific payer. I know they can only go into this doctor. Like, how do I get that out of my brain and feed that into an LLM? So for us, it's just like asking the right questions and then feeding that into an agent is what we do. In the future, I hope it's just like they can type it in and the LLM can ask them the right questions instead of us. So our job is just asking questions.
Yeah, I think that's where the forward deployed model is really effective too, because we go on site and it's just very difficult to be like, hey, come up with an idea that you want us to solve, right? It's very much like, we offer this product, let us come see what your operation's like, and here are all the different things that we think we could improve. And then you kind of just dig deep into each one of those and like make a timeline. Like first we might want to do like the fax processing, right? And then move on to scheduling. And then soon, like once we build a lot of trust with the customer, they kind of almost look at us like this AI engineer that's on their team. So a lot of times like what we get is the CEO of a large imaging group will just send us a request and be like, hey, like we're the customers are asking for this. Like one thing we did where a lot of referring providers keep calling back and being like, hey, is my patient scheduled? When is the report going to be ready? Like, when are you going to send us a lien for a lot of personal injury cases and things like that? And there's just full-time staff that are sitting there following these emails up, and they were like, guys, can you guys do something about this, right? That's kind of the extent of the problem that we heard. And very clearly it's obvious because we already have full syncs of all their data. So we put together a portal, and like we had this email agent that kind of just responded back to these providers, so nobody on the team could take it on. So I think that's kind of the flavor we're seeing today of, here's a problem, just find a solution. Eventually it could evolve to like describe the problem to this black box, and it just kind of puts together a workflow for you.
I mean, I kind of feel like that's the general tone I get when I speak to a lot of folks in your space, which is like, there's no problem that you don't really foresee that is unsolvable. Right? There's nothing you can't do. But then it's like, how do you? Well, who's your target customer? It's like, well, everybody. Right? Like, what's your target problem? Well, it's kind of anything. Is that scalable though? Right? Is it feasible that if you got a call from 50 different practices across the United States, one in every state, and I was like, hey, I need you guys out here tomorrow, and you're like, well, yeah, okay, you should go here, gosh, I'm gonna go over here. But then like, how do you scale up onboarding? How do you scale up the I guess the piece of where you're solving for their problem?
Fantastic question. Like, first of all, it starts with like I said, we're going piece by piece at a time. So when we started, like, we're focused on like pre-visit workflows. Well, let's just start there. Let's get everything they do before they get to the clinician. And then the second thing you asked is, well, onboarding. How do you onboard them faster? And for us, that is, we need to get context out of people's brains. We need to be able to then feed this into an LLM in a way that it understands it, because, like, to your point, hallucinations are a thing. You need to write instructions so clearly. It's like you're training a child from the ground up. And then third, we need to be able to integrate. So how can we then optimize our own operations using AI to do this quicker? So, okay, we know that, like, when we're onboarding somebody for document management, here are all the different nuances that, like, our agents need to take into account. Okay, agent, like, here's spit out this questionnaire of all the different nuances that we've covered, and keep that as like a current list of all the different questions we need to answer. Let's get on a 45-minute call with the customer, ask them each of these questions. I've got a meeting recording tool that will record all their answers. It'll feed that into another agent that'll then spit out the prompt, and boom. Like, now I've got the entire prompt set up. Second thing, integration. Let's record how you guys are doing your workflow today. Akash is going to go spin up a computer use agent that's basically going to go do the same thing. Another 45-minute call, boom, done. And that's like what we have to do to get them up and running in 3 days. And now, like, it's all about like, how do we then expand the number of use cases? And it's exactly what you're saying. It has to get to a point where it's generalizable enough. But today it still requires a little bit of expertise to be able to figure out, where do you need the extra evals? Where do you need the extra verification? Like, everybody today is talking about Claude Code, right? Like, Claude Code. you can make anything with Cloud Code. It's probably going to be pretty crappy unless you know how to do system architecture, right? So in an enterprise use case, you still need to apply a little bit of expertise to get things that are consistent, deterministic, and correct all the time, because it's healthcare.
Do you think, you're bringing up a really good point, obviously you guys are at the cutting edge of being able to take the upgrade models every time they come out and then deploy it. Many folks are thinking, well, hey, when can I, the simple practice owner, the simple user, or whatever it is, tell it, hey, Claude, hey, ChatGPT, hey, whatever, solve my workflow problems for me like Dime Health does. Be a Dime Health agent and solve that. Is that something that's in the foreseeable future, 5-10 years down the road?
I go back and forth on this, man. I'm curious about your opinion on this too, actually. I think it's like today, like we think of like generalized intelligence, like we'll just give it something and it'll solve it. I almost feel like we're going into this world of like generalized skill sets. So if we take a look at like how something like Claude Code works, it's a bunch of different skills that given it on how coders work. So like, let's go grep a code base, let's go search a code base for a specific function that we need, and they've just trained it on that, and that's so powerful. So they've given it that one skill set the coders do on how to like find this specific function, and that is one of the best like tools to actually go do it. So we're teaching it generalized skills. Does that then like eventually become generalized intelligence? I don't know.
Yeah, I'm kind of an AI optimist. I just think that all these things are going to be possible. So my answer has always just been like, well, look at where we are today, right? Like we spin up voice agents using AI, just like that. Like obviously it took a lot of underlying infrastructure investment that we put into our systems that obviously required skill from us. But now we're able to take one voice agent and clone it into another with a completely different set of requirements in a couple of hours. And it works perfectly out of the box. So I'm just kind of extrapolating that to like what it would be 10 years from now. Like if all this underlying work that we had to put in, why can't the agent do it itself, right? And we're kind of playing catch up here because like when we started this company, the models aren't as good as they are today. So how would I approach it if I were building the company today, right? Would I need to put in that much thought into how to build this kind of scalable infrastructure that can be replicable, or will the model kind of just be able to do that for me? And then 10 years from now, like I just think that there's just gonna be an AI like a black box. You just tell it what you want and it does. Yeah. But that's just my take on it.
Sure. Yeah, I mean, checks and balances will be interesting. At the end of the day, somebody's gonna own that data. Yeah. Right. There's different sets of data, right? There's the data that you're leveraging through the relationships with the clinics. There's a lot of clinic information. There's a lot of patient information. There's a lot of payer information. It's one layer of data. But then the platform by which you stack on top of also gets all of that data and the data you feed it to train it, right? And so somebody's owning all of that.
Yeah. That is true.
I mean, like goes back to the point of data's new gold, all that stuff, but ultimately like people are still just looking to get jobs done. People are still just want to get in, they want to get seen, and then the facility wants to get paid.
Yeah, for sure. Interesting. We touched on it earlier. You had mentioned there was some criteria that you guys have that differentiates you, Dime Health, from other competitors. Expand on that. Yeah. Tell me how you guys differentiate from the current offering in the marketplace.
Yeah, I think really it goes back to the integration. Our integration's our biggest moat, and I think this is where we do it better than everybody else. One, it's the speed. We get customers live incredibly fast, incredibly cost-effective solution too. Our integrations are completely free. It's just like having a human use an EHR system and be like, all right, make these clicks and tell us how you do this, and then we could replicate that exact thing. But the nice thing about that, it really plays into the scales framework. We can step into a problem that the customer is having and be able to figure out how that plays into our system, what kind of AI tools do we need to put in? Do we need to put in voice? Do we need to put in document intelligence? Do we need to put in some sort of coding agent, like anything like that? And then also be able to interface with the EHR itself. These portals are very complex, and they have so many different actions that the integrations into them just don't correlate the same way. There's the existing kind of interoperability framework that exists, like with FHIR APIs and HL7 protocols, is very limited. It's kind of a band-aid on top of a solution where the government was kind of like, hey, everybody needs to be able to interoperate, right? And so you have these like interfaces teams that exist at these EHR companies who maintain these really old kind of limited workflows.
Right.
And so with us, we've kind of just completely discarded that aspect of, we will come in, we will integrate with the HR the way a human does, and that's kind of the moat for our business, and that's why we do it better than everybody. But also, like, it's a very secure way of doing things. If you send an HL7 message into the ether, that message could be corrupted, and it could cause your entire database to break.
Right.
And it has happened. There's very many instances where if the interoperability engineer on the other side doesn't put the right validation steps, and you pass in like a digit, right, and it just goes into a database, and the database kind of just rejects it, and it's like, okay, well, no, I found something hazardous, and just deletes an entire patient. It's happened before. But at the same time, like, the UIs are quite limited. There's only a few clicks that you could actually make to get your job done, and so it's a sandbox environment that's safer, faster, and much, much more effective. And that's ultimately what sets us apart from our competitors.
That's awesome. And are you guys SOC 2 compliant?
SOC 2, HIPAA.
Yeah, that's awesome. How does, thinking about the integration, so you have, some of the biggest DMRs, Epic, Athena, you have NextGen, you have some of these things. Is there a process that each one of them requires you to go through to integrate?
So,
or do you guys just kind of tap in?
The way we do it, like using computer use agents, it's like exactly what a human does. It's mimicking clicks.
How do you get access though?
They just give us an account.
Who's they?
The hospital.
Okay. So who the entity by which you contract with for services adds you as a user, just like they would if you were employed by them, and they added you.
They're like an AI employee.
Yeah, and we go through their IT process, right? Like, because at the end of the day, like, a lot of these EHRs are managed in-house through an IT department. So we're going to have to go through the exact same security process of being able to integrate with them through, like, a FHIR API. So we go through that exact process. They vet us. They put us in a pen test and make sure that, all our data is secure and that our connections are safe. And we're no different than it would be otherwise to integrate with them.
That's a really good point. You think about how many people just share their username and password with the entire office, or what have you. Maybe you have folks in the office that aren't even technically employees of the organization that are accessing it. Sometimes they have offshore billers or offshore whatever that they're just like, hey, here, use this, because, and we do it all the time too, right? Like we manage several, tens of thousands of doctors and contracts across the state. Yeah. And there's a plethora of third-party whatevers that work for them, billers, schedulers, or what have you. And a lot of times they're in other countries, right? And they're like, hey, we need access. Like, we can't give you access. So what inevitably happens is that somebody locally just shares their credentials, and they log in, and we have no way of knowing, right? It almost seems like having AI agents that have to go through, your companies are HIPAA compliant, SOC 2 certified, you have all these things. It seems like it's almost a better way, right?
Yeah, I think so. It's also like, let's say we go through the old school of integration, right? You either give them direct database access, you go through some API. That's how, like, you're adding vulnerabilities to your system now. Like, okay, let's go to the full extreme, and somebody has direct database access, and the company, the vendor you're working with gets corrupted. Now, like, some hacker in Russia can hit you with a SQL injection attack and, like, shut down your whole hospital. Yeah,
and you're just opening up a port into the database.
Yeah, that's what you're doing.
As opposed to a very controlled sandbox environment that lives on your servers. And really all you're doing is, like, you're giving it some prompts to be like, all right, be able to click these buttons, as opposed to, like, here's full access to the mainframe.
Yeah, for sure. Makes sense. What? Tell me a little bit more about your team. I know, obviously, we get the pleasure of meeting you two, but who else is on the team? How many people you got on the team? Is everybody stateside? What does your team look like?
We've got a team of 8 people today. Okay. The entire engineering team is based here. We've got a couple of what we call AI evaluators, which help us run evals on the new models that come out. They're offshore. They're basically just annotators. So as we get, like, new models, we want to make sure that, like, we can upgrade without compromising accuracy. And they're the people that help us, like, make sure that, like, the model's is returning accurate things. So they, like, literally, like, manually stare at the data. Did we get it right? Does it match what we have here? Check. But our entire engineering team is here. We've tried it the other way around, where we had some offshore engineers, and it just doesn't work well to move fast as a startup, I'd say. Like, I want to be able to look over, talk. So we're all in office. Like, we all in office 5 days a week. We work together, and, like,
that's cool.
That's how you move fast.
Yeah, that's cool to hear from your generation too. I mean, post COVID, you guys finished college during the pandemic?
A little bit before.
2
years before. So my first job started, and 2 months later it was COVID.
Yeah. Gosh, that's crazy. That's cool to hear that you guys are kind of bringing it back. And that's the vibe here in Silicon Valley, too, is like, everybody's back in the office. Everybody's, what do they call it, 996?
Yeah,
996.
yeah.
But people are loving it. Like, I was excited to introduce you to the Better Human folks later, or June and his team. And I was driving through the city there was a dinner last night for it, and it was just vibrant.
Yep.
Like, there's tons of people around. I think the new mayor's done a great job of revitalizing the city and kind of bringing back some of that workforce. It'll be interesting to see what happens long term, in the state, 'cause you hear a lot about the wealth tax and some other stuff. But
how do you feel about that?
the wealth tax,
Yeah.
man, that's a hot one. I personally don't think that imposing a wealth tax is going to derive what the state needs, which is more revenue.
Yeah.
It's already pushed out almost $1 trillion worth of wealth from the
Going
state.
to Florida,
Right.
yeah.
Going to Florida, right? So it's like, and I think to the general public, it's an easy message. It's schoolyard politics, right? Vote for me for class president. I'll give you guys free pizza.
Yeah.
And everyone's like, oh, this is awesome.
Yeah.
Where's the free pizza coming from?
Yeah.
Somebody's got to pay for the pizza. And here in any state, it doesn't really matter if it's a state or a country, it's an easy message to sell to folks who look up and go, wow, yeah, why would I care if a billionaire doesn't, have 5% more money or whatever it is? Little do folks realize, like, it always rolls down. Like, it's easy to get a use case started at the top bracket. It's just going to roll down to everybody else. So what we're really saying is, do we want a wealth tax on everybody over time? And I don't think most folks think about it like that.
Right.
What about you guys? I know there's a lot of buzz around New York and what's happening over there. What are you guys' thoughts?
Well, we're aspirational, right? That's the great thing about America. Like, everybody, we might not be billionaires, but we believe we can get there. So we solve for ourselves in the future.
Absolutely.
It doesn't affect us today, to be honest.
It doesn't impact us. I will say this, probably diverting the topic a little bit.
Yeah.
What California and San Francisco specifically has going for it is, like, building is a norm here.
Yeah.
Like, you're not looked at differently because you're starting a startup. In fact, like, that is what you're supposed to do in here. Like, that is San Francisco's moat.
Right.
You can't replicate that elsewhere. You go to New York, we're odd. Like, people
we're
don't
really?
get what we do.
Oh,
man.
for sure.
Yeah.
New York is such a small startup scene. Like, we did Y Combinator here, just like right up the road, and it's so vibrant. In fact, like, this was the thing to be doing. You should be building an AI startup.
Right.
New York's still very much like finance lifestyle. Or there's a lot of, like, big tech lifestyle influencers coming out of there too, and it's all about, like, dinners and parties.
Sure.
And, it's not very conducive, but we have found a community there. There's a good percentage of people that we did YC with, who end up moving to New York, and we kind of just stick with them to kind of share the same ideals. But San Francisco is a place. They kept telling us, like, on the last day of YC, actually, our group partner was just like, I'm going to go around and talk to everybody who's not going to move to San Francisco. They were like, guys, do it. Sign a lease right now. Yeah. And their vision was, like, that entire dog patch area, you know what I'm talking about, right by the water? Yeah. There's a bunch of apartments there, and their vision is just like, let's all move in here, and let's just all be friends, and, serendipity is gonna take us places. And he was just going around being like, why are you not moving to San Francisco? What can I make you do to move here?
I've heard, I'm not in the tech space. I've advised for some companies on the health tech side. Most of them are looking like, if your headquarters is in Silicon Valley, it's almost like a 5 to 10x higher valuation.
That's what they say.
Just by being here. But I think the flip side is really cool. I think for younger folks coming up, to take a stance, to be like, nah, we're going to New York City. Yes, it's against the grain. Yes, maybe it's against the advice of what some other VCs or others would say. But there's so many people in New York. Yeah. You have younger generations of people going on like, I want to be that.
Yeah.
Like, you may not see them. It may not be tangible when you walk into the building in the morning, but kids are watching. Like, younger generations are looking up to you guys, going like, can we start a scene in New York? Can we do this here? Like, this is home, or this is where I want to go, or this is where I want to build. And so I think it's also inspirational, because what is Silicon Valley today? Will it look the same in 10 years? I don't know. As we talked about the wealth tax, it's already redistributed where folks live. Look at some of the biggest ones. Larry Page, the Google folks, Miami. Zuckerberg, Miami. Chamath, out of the state. Like, a lot of these folks are taking it elsewhere, which will then shape when you want to go pitch. They're not going to all come to Silicon Valley.
Texas.
Still going to remain here, but now they might fly to Miami.
Yeah.
And they might be like, hey, that apartment that you were going to rent a flat for $5,000 for a 2-bedroom, you know, down by the dog patch area. We can do it $2,500 over here, you know, on the water in Miami. Bring your whole team, and it's, you know, 5-bedroom. So who knows what that's going to look like, but I think it's really cool. It's a testament to you guys. Like, we're going to stand out. We're going to do something different. Tell me about your brand. Tell me about what you guys are doing to market your brand, grow your brand. What avenues are you taking that maybe some of your competitors aren't?
Yeah. Honestly, this is one area of Canada where you really, really need to do a better job at. Today, it's all about, like, how many people can we get the eyeballs on, right? Like, I believe we've got the best technology in the space. I believe that if you use our scheduling agent, you're going to find it the most realistic. It's going to be the most accurate, and it's going to do things the fastest. I know for a fact that our document extraction system is by far the best in the space. I've tried them all. So my job is, how can I get the most eyeballs on that and get people to see that? And to date, what we've done is just developed an outbound engine to get that in front of people. So what that means is the number of dials we make and the number of emails we sent is how many eyeballs we get on. Recently, we started now expanding into the organic growth channel, because at some point, like, you have to scale. Like, the distribution is just that. Like, the number of emails I can send does not compare to the number of impressions I can get or the number of views I can get. So 100%. we're looking at, like, how do we get more eyeballs on that? And for us, it's just like, let's share stuff that we find interesting ourselves, and then hopefully people resonate with it. Just because there's so much, like, garbage out there, so much, like, clickbait out there, and instead it's like, why don't we focus on creating stuff that, like, we're at the forefront of this stuff. I'm in the right Discord groups. My Twitter algorithm is feeding me the right kind of stuff. We're trying this stuff and knowing what actually, like, works. So if we can just distill that knowledge down, and literally, like, how would we go and find stuff interesting? Like, what do I watch?
Like, who do you follow? Like, what when you pull up your phone, what's the first platform you check?
The first platform, Twitter. Yeah.
Twitter?
Yeah.
Okay. And then who do you follow? Like, who are you looking at? Just not inside of the industry, but, like, people that you've clicked follow that you look at and you read their stuff. Who is it?
Dharmesh.
Who?
Dharmesh.
The HubSpot guy?
The guy that interviewed Daria.
Oh, Dwarkesh.
Dwarkesh.
Yeah.
Okay.
Dwarkesh, definitely. Like, if you go to my YouTube algorithm, that's where it's gonna be. Dwarkesh, Wendover is a pretty big one. Like stuff that teaches you, basically.
Right. But look at what they do. They record everything.
Yeah.
Right?
Actually, it's great that you say that, because, like, YC's channel right now is severely content
forward,
because they made it in a way that it's like, there's Dalton and Michael, there's Light Cone podcast, like, they've just branched off in so many different ways.
It's the cheapest way to get in front of the most people. Exactly. If I'm you guys, listen, I'm not a big content creator, right? We talked about, this is episode 7. But for the exact same reason, it's like, I want to get in front of as many people at one point in time as I can, and it's going to take time. Healthcare podcasts aren't like an AI podcast. It's not like a tech podcast. It's not like an influencer, somebody who's just saying rage bait stuff to get clicks, right? Yet, it is the greatest opportunity at the lowest cost to get in front of. Like, you're in New York. Try to get in front of Gary Vee. Right? Like, he's like one of the OGs at, like, content.
Right.
And what you guys are doing, I can tell you, because I consulted with several, and I talked with them about their strategy around social and brand, and they're all like, we're so focused on this. I'm like, then just record it. So put a stinking camera up in your office and record conversations and just put it out. Right? Like, do more of these.
No, it pays too. Like, in B2B SaaS, that is the playbook today. Like, we see it. We see it on LinkedIn, Twitter. Like, they got, like, buses going around with all these startups' names, and it is the name of the game. Those startups are doing incredibly well.
Let me ask you a question. Like, we mentioned Gary Vee, people that have, like, just these massive brands, just, like, massive reach. We're talking about healthcare here again, in niche. Like, how do you, as we're distributing content, how do you, like, make sure that you've reached the right people, or is that not even the name of the game? It's just get as many people as you can, and then some fraction of those people are going to be the right people.
I think for you guys, it's one is capture, right? Like, you have to document. And if you don't have anything to document, you can't distribute.
For sure.
Right? So number one is, like, start documenting. You know, it's very inexpensive to grab a couple of cameras. You don't even have to hire a team. Like, there's a lot of apps that you can just put a link to this into Opus Clips, and it's going to spit out 40 different, 30-second clips that you can repurpose. So start by capturing. And people want to hear it. Like, especially in the startup scene, people want to, it's not just like reading a Substack or reading a Reddit thread of, like, this is what's going to happen. It's like, no, like, these are the conversations that we have. Dang it. Like, did you see how that thing broke? Like, all right, what do we got to do?
Yeah.
Like, you could live stream it,
That's
and
true.
you're gonna have a bunch of people that are on there going like, oh shoot, how do they do? Okay,
Yeah.
boom, 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 boom.
Yeah.
Like, people want that, and maybe at first it's not as massive volume.
Yeah.
So I think one is capture, and then two, how do you come down to distribution, right? I think first off, you have to have everybody on your team like literally resharing, reposting, all that kind of stuff. But getting it out there is going to be attractive. What's going to happen is you're going to find some people that follow and watch because they're interested in building. Well, for you guys, it's like, well, it doesn't generate customers. It does, because now you're going to add mass. Right. And everything kind of, a high tide rises all boats. So as you start getting into these different market channels, competitors are going to tap in. Like, what are they doing? And now, because you have more people coming into the feed or into your algorithm, it's going to push it further.
True.
And so you're going to get more, and it's going to push it further. I mean, think about this. You guys go into practices. What's the age range of most people that work at the front desk, the MA station, the back office?
40 to 60.
What do they all use?
Twitter, LinkedIn, Facebook.
All of YouTube.
Yeah.
All of them do. Right? Now, I'll bet you each and every office that you go into has somebody that's under 40 in it. That's under 30 in it.
Yeah, absolutely.
Right? All of them.
Instagram, TikTok.
Instagram, all that kind of stuff, right? I tell this to my practices all the time, because I'm also trying to encourage as many physicians and practices to do the same thing. Like, you want more patients? Don't ask a payer how you get more patients.
Yeah.
Build your brand, and patients will see you, and if they like you, they're going to come and see you.
That's how you found your last doctor.
I literally, all my doctors are from TikTok. It's because they do exactly that, and they get their patients to be like, I'll give you a discount if you, document this procedure or something like that. So you see all these people going, like, people with great skin going and getting like laser
100%.
treatments, and then you're like, I know, I'm going to that guy.
That's right.
Right.
Now you want to be that within your space.
Exactly.
Because let's be honest, most people are using OpenAI as the base layer for a lot of what you're doing. Right. Most people are taking the same when I say people, businesses that you're competing with are taking the same use cases.
For sure.
Right? Everybody's going to say that theirs is better.
For sure.
The truth will be told at the end of the day when somebody hires you and they're like, hey, this is fantastic, or they've already used somebody else, they bring you on to do a test pilot, and they're like, all right, we're going to offset that contract, we're going to bring you on. That's great. But what you need is more people going, hey, can you come to my business?
Yep.
Right.
And we want to try that. I saw you on my MA, saw you guys on TikTok. My MA is inundated all the time with this vaccine schedule thing, and they can't figure out how to keep the fridge. And oh, can you guys do that? No, we can't. That's the kind of inbound. So I tell doctors and practices all the time, but the seniors aren't watching it. First off, that's not true. 65% of people over 65 use YouTube as their number one platform.
Yeah.
But secondly, if you watch something and you call home and like your parents or your grandparents or whatever, like, hey, you should go see this doctor. They specialize in this thing.
Yeah, that's true.
You're going to get the word of mouth referral off of your content.
For sure.
Yeah.
Right?
It's funny you say that, because old people do watch a ton of doctor reels. Like my grandparents are both just like glued to their phones these days, and they're every single one's like some doctor talking about some treatment, or like follow this diet, eat this kind of fruit, like go get your get a colonoscopy, like those kind of things, and it works like even at that age range.
Absolutely. And then the last thing I would say within that is like build who you want to connect with up that chain. Like I would strongly encourage you to connect with Gary Vee. He does like sit downs in his office all the time. The folks I'm going to introduce you to later, Arjun's brother Neil did the same thing 5 years ago. They're in the mortgage space.
Yeah.
Okay.
How dry is the mortgage space?
Right.
And they've blown up. He's got hundreds of thousands of followers on Instagram, puts on massive events every year, does mastermind groups and boot camps and all this kind of stuff for people just to sell mortgages when the rates are public.
Yeah.
Right? Like the rates are down 1/10 of a point or 100th of a point today, and like that's the kind of stuff they do, and they draw a massive following. You guys are in the health tech AI space. Anything with AI is way higher, right? Build your hierarchy of who you want to connect with, and then within the healthcare space, right? Like you're on LinkedIn, like you see all the people like Eric Ricker, I think from A to Z Healthcare.
Yeah.
He's on there. He just did Mark Cuban. He did an interview with Mark Cuban.
Yeah.
I try to get in contact with some of these folks and say, hey, this is what we're doing. We see what you're doing. Is there an opportunity to collaborate?
Especially now with all the discourse around where is AI going, because everybody's getting a little scared, right? They're like, oh, this new model is able to do all this. To kind of be in the forefront and be like, we are doing it.
Right.
That would be powerful.
Yeah, for sure. And first to market for a lot of things is that if you start generating buzz around who you are and inbound, you're going to separate yourself, and you don't have to send as many emails and cold outbounds.
Yeah, it's also like the CEO of Mount Sinai is not going to respond to our cold email.
For sure, exactly. You're never going to have people.
But they'll
They have to.
That's another thing too, right? Like get yourselves in the right circles with what the industry's doing and stand out.
Yeah. Yeah, curious your thoughts on how to work a conference, because we've kind of done both ways of we attend, just try to network, and then we've also, been a vendor, done speeches. Most of the time it hasn't been super fruitful for us, because also we can't afford to participate in the really large ones.
Yeah.
But yeah, curious how you work
I would
these.
suggest if you use it as an opportunity to create content and multiply that event into the social media world,
Yeah.
you're going to have far greater compounded interest than anybody else that's going.
Right.
Most folks are doing the same thing, like you said. We're sponsoring a tent, and you're just kind of got some foot traffic, and you're shaking a couple of hands, but most people there are just kind of there at a good time, and maybe it's not the CEO of the big healthcare company or the big hospital agency or whatever that you want to network with. But the conversations that are had that come organically. What do you guys do? Oh, boom, 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 boom. This is what we do. Oh, really? I was thinking about this, and you have a take on it.
Yeah.
Record that. Like, use that to then continue to catapult your brand and create awareness.
Yeah.
I would also say try to differentiate if you do get an opportunity to speak. Differentiate how you say what you say.
Yeah.
Make it stand out and record it, right? And get a cameraman there. And talk to your investors. Like, listen, these are the top 10 competitors we see in our space, right? You probably have Mila Health, right? Have you heard of them?
Yeah.
Luma,
right?
Health,
You got some of these other ones, right?
Yep.
We don't see them doing X, Y, and Z, and we want to invest in this. We need camera people. We need some audio, video. It's not going to be, from an investment standpoint, it's less than hiring a full-time person. It's less than an engineer, but it's going to provide dividends that help you guys get reach and then drive inbound. So I would use everything as an opportunity just to create content that other people aren't doing. You can match or beat the skill set for the actual product that you're developing, and you layer on top of it your content strategy, it's off to the races.
Yeah, I love that, man.
Yeah,
I guess like a lot of the times it's just been like, will people even be interested in this?
Yes.
Like, okay, Akash and I are dealing with XYZ bug today. It's shut everything down. Now if for us it's
Live
just like
stream it.
another day, right? Did anyone care about that? But if we do live stream it, to your point, who knows? Like, I show startups, it might be cool to somebody out there, and then that'll be cool to somebody else.
Dude, I think it's all how you frame it.
Yeah,
too.
it's fair too.
You know, like you guys are. You know how many people would love to start a company that never get to the point that you're at?
Yeah.
How many kids go to college
Fair.
that look and go like, what am I going to do after college? This is wow. All of the schools that you went to, you guys both went to Michigan, then you went to Georgia Tech.
Yeah.
You know, like you have connections back there. Like push that downward. Like, hey, this is what we're doing. We're trying to launch. Can you get this in front of your students? Can I come speak at your school? Can we like go use every single opportunity? Demand will. Everybody wants to be a startup. I should say everybody. There's many people that want to start a company.
Yep.
And they're gonna look up to you. You're reachable. Like you're still in the age range where you're not yet Larry Page.
Yeah.
You know, like at one point in time he was in your shoes. And there's people that look at that. And kids want that. Like my kids. Like they're coming to the event today. Because I want them to see people that are hungry and motivated, that aren't just getting traditional education. Like, how do you market and scale and grow a business? By doing this.
Yeah.
You know, like, absolutely. So I think some of it is how you frame it. Is there people that are going to be interested? Sure. Is it the same people that are going to want to watch iShowSpeed, watch video games, or play video games?
No.
Probably not. But they will age up.
Yeah.
At some point in time, they're going to look at it, you know? So I wouldn't set the expectation of, like, how can I get 15 million followers? Because you don't need that. Like, how do I create a content and distribution channel that leverages what we do to touch people that we can't on a one-to-one basis? And give you something.
It's awesome. One of our connections actually, one of my friends, Maitri, she's exact same space as us, and she does exactly what you're saying. Like she's throwing summits, like she's at every conference, like full on content creation. She's like talking to senators and just recording that, and it's the #1 growth strategy, and just doing exceptionally well in this exact space.
For sure. And if it's not you guys, maybe it's somebody on your team.
Yeah.
Right? I mean, both of you guys are eloquent and you can articulate what you're saying. So I think you got it. But if you feel like it's not you, like that's what a team is for.
For sure.
Right? Put that together. Yeah. Okay. One question I like to ask all my guests, because it is a healthcare focused podcast. What is healthcare to you guys? In your own words. You don't have to have some preconceived definition. But in your own words, what is healthcare?
Healthcare. Okay, so when I think of the word healthcare, it's always in a negative connotation. A lot of times, people complain about healthcare. People complain about patient care. People complain about how expensive, and these are all very valid because I complain about it too.
Sure.
Expensive, inefficient, slow, and all those things kind of resonate with me. But there's also healthcare as a science, which is absolutely beautiful, right? Like, we're able to live well past our natural ages these days. The technology that's coming out, the cancer research, the procedures we could do, are just so cool, and they really are magnificent. And I think it is the biggest innovations that humans have ever made. So really, when I think of healthcare, it's a dichotomy, and I think where I get frustrated is the first part, and where I get fascinated is the second. So I think that's where I would like to solve problems in the actual parts that I hate.
Yeah, healthcare for me, like if I just zoom out, it is taking care of my physical and emotional self, is how I describe it. The only thing that I don't necessarily equate to healthcare is my spiritual self, which is something that I put outside that zone. But like, healthcare is everything that I have to do to keep my body running, because it's all a system, right? Like, it's all the spiritual connection that I have in my mind that connects down to my whole body, the emotions that regulate my discipline, my thoughts, my emotions. Like, those things are, if I take care of that right, and I use the right professionals and the right coaching, whether they're doctors, whether they're therapists, and I do that right, it is how I keep my system running effectively.
Yeah. Respect. I love it. I appreciate you guys coming out.
Likewise,
I wish you guys nothing but the absolute best of luck, and we'll be happy to connect you with as many people as I can, and continue to support you and create some competition.
Yeah,
I think competition is healthy.
We're always down for competition.
Friendly battles. Yeah. I appreciate the advice, man. Thank you so much.
Appreciate it. Anytime.